Hello, this is Steve Del Castillo. I am the Deputy Director of the Cllaro Latino Leadership Advocacy and Research Organization, Cllaro. Cllaro is formerly the Latin American Research and Service Agency, La Raza. We have been in service over the past 50 years, since 1964. Welcome to today's presentation around the Affordable Care Act and mixed status immigrant families. The purpose of today is to present on this situation, and it is made possible by a grant from the Colorado Health Foundation. The purpose of the grant is to conduct a series of presentations for community members and healthcare providers related to immigrant families with mixed family status, a term we will discuss shortly. As you'll see that we'll present information related to the requirements for enrolling eligible members into the appropriate healthcare coverage. Also, you'll notice that the presentations are both in English and in Spanish. And while I will present primarily in English, there will be an opportunity for those whose primary language is Spanish to look at the slides and then also learn about enrolling for healthcare coverage. Also, I'm going to introduce you to the Lopez family, a mixed status immigrant family who face the challenge, as all families do, about enrolling in and for healthcare coverage. First of all, let's talk about the requirements for healthcare coverage. The Affordable Care Act of 2009 requires all citizens and legal residents to have healthcare coverage. This includes members of immigrant families who are citizens, referred to as families with mixed family status. First of all, what is a mixed family status? What does that mean? A mixed family status is a household made up of individuals with different citizenship or immigration statuses. So for example, you may in a family have a father who is undocumented, a mother who is a citizen, an adolescent granted deferred action through the Deferred Action for Childhood Arrivals, or DACA, and a child who is a citizen. And referring to the mixed status of immigrant families, it does refer to those families who do have the different statuses among the family members. And usually, the case has been, in most oftentimes, is where you may have children who were born in the U.S. and have citizenship by being here in the U.S., and at least one parent who is a non-citizen. There's some confusion about who is required to enroll within a mixed family. The regulations say that any family member in an immigrant family who is a citizen must be enrolled in healthcare coverage. This is according to the National Immigration Law Center, an interpretation that was developed in October 2013. The question now is, where can I apply? In Colorado, you can apply through the Health Exchange, referred to as or named Connect for Health Colorado, in one of three different ways. You can go online at www.connectforhealthcolorado.com. You can call and enroll by calling 1-855-752-6749. Or you can make an appointment to go into the enrollment center, into one of the enrollment centers at 1-855-752-6749, where they will have bilingual staff to help you through the enrollment process. Who is eligible for coverage under the Connect for Health Colorado? Persons who are citizens or legal residents are eligible to apply. Persons who are not documented are not eligible, and DACA youth are not eligible to apply through the Connect for Health Colorado Health Exchange. Oftentimes there are questions about eligibility for Medicaid or CHIP, the Child Health Program. Qualified immigrants who have been residents for 5 years are eligible to apply. And some undocumented immigrants may be eligible for Medicaid or other state-funded programs. Persons who are not eligible for Social Security may file income tax returns using the Individual Taxpayer Identification Number, or ITIN. And information about, and this is an important piece of information about applicants and non-applicants may be used only to determine eligibility for insurance, cannot be used for any type of immigration enforcement. There's some key points for mixed status families. Any ineligible family member, that is undocumented parent, may complete an application for an eligible family member. For example, the U.S. citizen child, the child born in the U.S. And these are key points. By law, individuals who are not applying for themselves, that is, non-applicants, are not required to provide information about their citizenship. Again, by law, information about applicants and non-applicants may be used only to determine eligibility for health insurance and for no other reason. Now, who's an applicant? An applicant is a person who will use the insurance who may or may not be the person completing the application form. For insurance eligibility, must be either a U.S. citizen or lawfully present in the U.S. and be resident of the state where applying. In addition, there's verification of citizenship or immigration status, usually through some type of government databases. For example, through IRS income information, driver's license, are some examples. Now, if you look at the chart in front of you, you'll see that there are some possibilities that folks may be able to receive some kind of financial assistance depending on your status. So, for example, the question is, does my family qualify for financial assistance to get health insurance? If we are, and if you'll follow the chart, on the left side, if we are lawful permanent residents, green card holders, or refugees, the answer will be yes. So what do I qualify for? You can qualify for private health insurance, financial assistance to help pay for insurance if your monthly income is between $1,342 and $3,890 if you are an individual. If you are a family of 4 and your income falls between $2,743 and $7,950, you will qualify for assistance. If you qualify, or you may qualify for Medicaid, for free or low-cost health insurance, if you've lived in the U.S. for at least 5 years and your monthly income is $1,342 or less for an individual, or $2,743 or less for a family of 4. Or you may qualify for the Child Health Plan Plus CHIP. You may qualify for free and low-cost health insurance for children and pregnant women if you live in the U.S. for at least 5 years and your monthly income is $2,529 or less if you're an individual, or $5,168 or less if you're a family of 4. Now, what if the answer to that first question for qualifications for financial assistance is no? That is, you are undocumented or DACA, deferred action for childhood arrivals. So your options are You can use the blue guide, which is, you can find it in the health service guide that allows you to look at options for healthcare coverage, or you may buy private health insurance. Now, I'd like to introduce you to the Lopez family. The Lopez family is a Colorado family of 5. Mom, Dad, and Juan were born in Jalisco, Mexico, and have been in the U.S. for 12 years. The twins were born in Colorado and recently celebrated their first birthday. Now, Juan is a DACA recipient, and his twin brother and sister are U.S. citizens. Mom is a legal permanent resident, and Dad is planning on applying for citizenship this summer. Now, in the past, the Lopez family finances have made it such that they have private health insurance has been too expensive for their family. Although Mom was insured under CHIPRA during her pregnancy, and also once had to go to the ER, the emergency room visit, and it cost the family $6,000. So you can see the financial challenges that the family faces. Now, Mom is worried about the healthcare exchange because she's heard that it's a government program, which is a little frightening for her. The exchange could share information about her family's legal status to authorities. She's also concerned about enrolling in the healthcare exchange, that could affect any future immigration cases for her family and prevent them from becoming citizens because of a public charge. Now, recall that none of the information that's used in enrolling for health insurance can be used for any type of immigration enforcement. Now, Dad has heard about the penalties for individuals who have not health insurance, and he wonders if his family would be penalized and what it will cost him. So we have 2 issues there. The first issue is around Mom's concern about the immigration enforcement. As we mentioned earlier, that information cannot be used for immigration enforcement. Now, let's talk about Dad's concern and the penalties. As of 2015, if the eligible family members have not been enrolled, the penalties are as such. It's $325 per adult and $162.50 per child, or 2% of the family's income, whichever penalty is highest. And as you can see in the chart, that in 2016, that amount will be raised to $695 per adult, $347.50 per child, or 2.5% of the income, again, whichever penalty is the highest. So you can see that Dad's concern is valid based on the numbers. Now, Dad, unfortunately, ACA prevents undocumented immigrants from applying for health insurance through the healthcare exchange. The ACA, however, does give money to state and local programs that provide health care regardless of immigration status. These are the local and state programs and are usually less expensive than the emergency room visits. In addition, ER services remain available to everyone regardless of immigration status in the case of an emergency. Since Dad is ineligible for the ACA, the Affordable Care Act, he is considered exempt and will not be penalized under the individual mandate. A key point. Juan. Even though Juan is considered to be legally present in the United States, DACA recipients were not included in the list of lawfully present immigrants eligible for ACA. However, Juan, like his parents, may be eligible for local programs such as Kaiser's Bridge program. The twins were born in the U.S. and are U.S. citizens. They may be eligible for financial assistance through the exchange or Medicaid, depending on the Lopez family income. Because of the ACA, the twins may apply for a child, which allows U.S. citizens' children to be eligible regardless of the status of their parents, and even if the applying parents are considered to be the head of household. Now, applying for the Affordable Care Act, mom and dad can apply for the twins, though dad is undocumented and mom is a permanent resident. By law, non-applicants are not required to provide information regarding their immigration status. Although mom and dad's social security numbers will be requested in the application, this information is not required and can be left blank. Income verification is required and must be submitted by all members of the households, mom, dad, and one. The information is used only to determine eligibility and is protected by law. Additional income verification may be requested. The twins may be eligible for Medicaid or CHIP on the exchange. The application process will determine the eligibility for these programs. And if the Lopez family's income is 400% of the federal poverty level, the twins will be eligible for Medicaid expansion. Now, a few points regarding the application. Information about applicants used to determine eligibility for health insurance will not be used by Immigration and Customs Enforcement, ICE, or the Department of Homeland Security, DHS, for immigration enforcement. An applicant is the person who will use the health insurance, not necessarily the person who is applying for the insurance. An applicant's citizenship or immigrant status will be verified using government databases, such as driver's license, IRS information. Non-applicants should not be asked for the citizenship or immigrant status. Eligible family members may apply. An ineligible person may apply on behalf of the eligible family members. As we mentioned, for example, an ineligible parent may apply for their eligible children. And persons not applying for themselves are not required to provide information about their citizenship or immigrant status. I keep reinforcing this point because there is some confusion about how the information can be shared. And finally, you must apply by February 15th, 2015 to avoid penalties. It's an important deadline. Please keep that in mind. February 15th, 2015. So please remember to enroll by February 15th, 2015. Thank you very much for your attention.